Gujiyigu or hello in Gatang language. I'm David Edwards. I'm a Warramo man and I'm recording this presentation in Widjabul country in northern New South Wales. I'll be presenting with my colleague Sharnie Roberts, a Widjabul woman, and we're both based at the University Centre for Rural Health here in Lismore in Widjabul country, which is a part of the University of Sydney and also part of the E-Mental Health in Practice Consortium. But more about where we're from later. So today we're going to give you some background on the WellMob Indigenous Wellbeing website, the what, the why, and who's it for. My colleague Sharnie Roberts will give you a quick demonstration of the website. We'll showcase some resources that you'll find on WellMob, and we'll briefly talk about how these resources that you'll find can be used in your health and wellbeing work. But before I start, I'd just like to acknowledge all the previous workers that have put some input into this project, as well as our deadly Indigenous advisory groups, learning circles, and more recently, our website reference groups made up of frontline Indigenous health workers based in Larrakia country in Darwin, in Ghana country in Adelaide, and here also in Bundjalung country in Lismore. Without them, I wouldn't be presenting on the website today. I'd also like to acknowledge our deadly little team of part-time workers. All our names are there on the slide. And we're part of the E-Mental Health in Practice Consortium, as I mentioned, which along with the University Centre for Rural Health and University of Sydney is made up of the QUT, the Menzies Health Research Organisation, as well as the Black Dog Institute. And we developed the WellMob website in collaboration with the Australian Indigenous Health Infonet. So what is WellMob? It's essentially a tool for wellbeing workers. And when I talk about wellbeing workers, I talk about everyone from youth workers and NDIS and community support workers, right through to our clinicians, our practitioners, GPs, psychologists, and allied health professionals. Essentially, the website is for them, but it's for them to use with our Aboriginal and Torres Strait Islander community, their clients. And it's a great tool for them as it's a digital library of culturally responsive online social emotional wellbeing resources that are made for and by our mob. And when we talk about online resources, I'm talking about websites, apps, as well as videos, podcasts, social media, and print. The main thing is that the website has been designed also to be equally accessible and usable for our mob. It's plain language, friendly layout, and culturally inviting format makes it easy for our mob to use. It's free of charge wherever you got Wi-Fi, and it's available 24/7. I'll just give a very quick run through of what the WellMob's about by showing you our almost completed video, which is a bit of a sneak preview in this forum.
WellMob is a website to help our Aboriginal and Torres Strait Islander mobs stay mentally strong and feel deadly. It's a digital library of online wellbeing resources made for mob from all over the country. WellMob is developed by and for our mob and brings together the holistic concept of social and emotional well-being to build connections to our stories about land, spirituality, and ancestry. Search under the main topics relating to mind, body, mob, culture, keeping safe, and healing. Or go to our training tab for health and wellbeing workers. Whether you're a health or community worker or just one of our mob, the WellMob website is your one-stop shop for digital wellbeing tools. WellMob makes it easy to search for apps, websites, podcasts, documents, social media, and videos that help our wellbeing. And it's not just about mental health. It captures our stories to connect us to country, culture, and our diverse communities. It's that easy. Search WellMob, watch, listen, and learn about our Indigenous ways of holistic mental health and wellbeing. Go to wellmob.org.au and show your support with a like, follow, and share. These are the homes of ancestral spirits, and WellMob walk lightly with gratitude and respect. WellMob is a website to help out.
So now you have a bit of an understanding on what WellMob's about. Just want to clarify why we did develop the website. And the idea wasn't ours. We can't take credit for it. It actually came from frontline Aboriginal health and wellbeing workers in Bundjalung country here in Lismore, northern New South Wales. As part of some training to upskill them about searching, finding and using online wellbeing resources with their clients, they suggested it would be much easier just to put them all in the one place, and hence the idea of WellMob came about. Our frontline workers also said they needed resources that were more based on the bigger picture of Indigenous social emotional wellbeing, and not just about mental health, which is more problem focused. So the broader scope of Indigenous social emotional wellbeing was used as a framework for the type of resources that we would link to WellMob, as well as the design and features. So we really looked at a strength-based model to curate digital resources that were already out there. We haven't developed any, we've just put them in the one spot. And they can help our mob stay connected to country, culture, community, and kin. And as I mentioned before, WellMob was developed under the guidance of our frontline social emotional wellbeing workforce across the country, with the Australian Indigenous Health Infonet as our website developers. So let's have a look at how you can actually use the WellMob website. And a short video here that will be presented by Sharnie will give you some tips and tricks about how to navigate the website and find a resource in just 3 clicks.
Hey you mob, my name is Sharnie Roberts and I'm a Bundjalung woman and I work in the WellMob team. WellMob is a website that brings together over 200 digital wellbeing resources that are culturally appropriate and relatable for our mob. So let's take a look and I'll show you how easy it is to use WellMob. The main topics are mind, body, our mob, culture, keeping safe and healing. If I click on culture, for example, up the top here we've got descriptions that explain what this topic means for our mob. On the subtopic page, we've got resources on language, music and dance, art, bush tucker, culture and identity, and our stories. We are going to check out our stories. At the top of the page, you'll find a short description on the topic. You'll find all resources related to this topic on this page. The most recent will be at the top, and on the bar here to the right, you will see what type of resource it is. Take time to have a look, and when you find interesting resources, click on more info, and you'll see that it takes you to the resource page. And that's the idea. In 3 clicks, you'll find culturally relevant resources without spending any time searching the web. And you know us blackfellas, we like to yarn, so please tell the mob about WellMob and the resources that you like. We encourage our non-Indigenous health workers to use WellMob with your Indigenous clients. So share this around if it's helpful, happy searching, and please keep in touch. Hey you mob, my name.
So just to clarify, the WellMob website is a collection of existing online social emotional wellbeing resources made for and by our mob. And we've mentioned them before. This includes other websites, apps such as the iBobbly and Stay Strong counseling and self-help manage. Can I retake that one from just before? Let's start this slide again. So just to recap on what WellMob is about, it's a digital library of online wellbeing resources made for and by our mob. So this includes apps such as the iBobbly app, which we'll hear about shortly from Tiani Schaefer of Black Dog Institute, and the Stay Strong app, which is a strength-based counselling tool to be used by practitioners with Indigenous clients. Websites such as the Ngar-wu Proud Spirit of Australia website, which has a great collection of COVID-specific resources to help our community get through the pandemic, as well as other resources such as videos, podcasts, webinars, and a whole other range of narrative-based resources, which we can easily digest and can help our workforce explain a range of health and wellbeing issues to our mob. So how can you use WellMob in your work? Well, the main thing is that for those of you who have a client-based role, WellMob can be used in the context of providing information around health issues and wellbeing issues by sharing a resource with your client in session. So if a health topic comes up, that you can search under the WellMob search bar or under the main topics such as mind, body, culture, healing, and safety, and then sit down with the client in session, run through the resource step by step, and talk about how they might understand it or use some of the information to integrate into their wellbeing practice. The website's also there to support those of you who have education and health promotion roles. There's a great range of resources from videos to printable fact sheets and posters that you can use in various programs to promote our health and wellbeing. And secondly, the main area that you can use WellMob in your work is to support yourself in professional development. There's a great training resources tab up in the top toolbar that you can click on and find some training resources, as well as some self-care resources for our Indigenous practitioners to help them connect to culture and some of the other strengths that we bring into our health and wellbeing roles. And also for professional development, we've received lots of feedback from our non-Indigenous practitioners and clinicians that WellMob's a great place for them to get a better understanding of cultural issues our mob may present with, physical and mental health issues, some of the social determinants of health behind those issues, and improve their cultural capacity and competency to work better with our mob. So just to showcase a final resource that you will find on WellMob, I'm going to hand it over to Tiana Schaefer of the iBobbly team with Black Dog Institute, who's going to talk about the free app called iBobbly.
So I guess thinking about the differences in how Aboriginal and Torres Strait people understand their social emotional wellbeing and what impacts it, it's really important that we have culturally appropriate tools and apps available, and that's where apps like iBobbly come into the picture. They play a really, really helpful role in helping us overcome different issues such as costs, feelings of shame, lack of services, and in some instances where those young mob may have family members working at the Aboriginal medical services and they may be too shamed to go into those services. So iBobbly is a good start in that sense. So what is iBobbly all about? It's a free social and emotional wellbeing app for young mob aged 15 and plus. And it helps by, it helps people feeling down, sad, or even just for those young people who want to learn different strategies for coping. And when I say young people, my nana also likes it as well. So you don't have to be young to use iBobbly. It's anonymous, and assuming the young person has some data, it can then be accessed anywhere at any time. And I should note that once you initially download it, you don't need Wi-Fi or data or credit to use it. And it can be downloaded in both the Google Play Store and the App Store. So I might just play a quick promo video of a little bit of background about iBobbly.
iBobbly has been designed to help young people like you to manage sad and worrying thoughts. Developed by experts in the field and Aboriginal and Torres Strait Islander people from your communities, it's been specifically designed with your needs in mind. It helps by showing you ways to manage your thoughts and feelings, as well as how to decide what is important in your life. Importantly, everything that is seen, heard and experienced in the app is shaped by Aboriginal and Torres Strait Islander community members to ensure that iBobbly is culturally informed and safe. Aboriginal and Torres Strait Islander artists and graphic designers created new artwork for the app. Young people gave advice on what language to use, and local people gave their voices for the audio recordings and stories. Using the app will feel like you're having a yarn with a family member. When young Indigenous people from the Kimberley tested iBobbly for just 6 weeks, they said they felt much better after using the app. So if you've been feeling down or having thoughts of hurting yourself, give iBobbly a try. It might just be the support you need to get yourself feeling deadly again. But remember, if your thoughts of suicide or hurting yourself are stronger than you feel you can control, there's no shame in seeking help, and it's important that you talk to someone as soon as possible. Click on the help icon in the top right-hand corner of the iBobbly homepage for a list of help and support options you can contact anytime.
So I guess thinking about
So just to recap on our presentation today, WellMob's for our frontline health and wellbeing workforce. That ranges everything from our community workers through to our clinicians. It's a digital library of online wellbeing resources that can be used as another tool in this toolkit to work with our mob. And it's available at wellmob.org.au. And should you require any additional information, our email is on the screen there. So in the questions and comments section, we'd just like you to think about what sort of supports you might need to help you use some of the online resources that you might find in WellMob in your work, whatever role that may be. And we'd invite you to stay connected by following us on Facebook. And we're about to launch a YouTube channel with some of the videos you've seen today, along with some others that we're developing on how to use the WellMob website and use online wellbeing resources in practice. You can also subscribe to our newsletter, which is available on our landing page of the website. If you go down the bottom and look at the Stay Connected section, you will see a link to our newsletter where you can check it out and subscribe. Thanks very much for your time. I look forward to having a yarn in the Q&A later.